For more than 15 years, the Red Cross has made substantial investments to reduce the risks of disasters and to strengthen the resilience of vulnerable communities in the Philippines. This is because this nation of 7,100 islands, with more than 90 million people, is among the most disaster-prone countries in the world, each year being affected by typhoons, earthquakes, landslides, and volcanic eruptions. But have those investments worked? In an effort to find out if the communities really are safer and better prepared, the Red Cross undertook a qualitative impact study and cost-benefit analysis. The purpose was to measure the effectiveness of both disaster preparedness programs and infrastructure projects that were intended to reduce the impact of emergencies.
Well, it's been frequently argued that it's much more cost-effective to invest in preparedness than response. Now, this study is exactly that. It's trying to illustrate that this is the case.
In Ambique province, the Philippines Red Cross, supported by the International Federation, built a footbridge over a river prone to flooding. The footbridge connects two communities in the same village, which have previously been cut off from each other during the rainy season, where the river could only be crossed by boat, which was dangerous in strong currents. Some children had been cut off from the school, and others had been unable to cross to visit the clinic on the opposite side of the river. Today, that problem is solved.
If there was no footbridge, I can't go to school and I will wait for the water to be lower.
Beyond its original intent, the footbridge has also supported livelihoods, ensuring that during the rainy season, people can bring their goods for sale to local markets on the other side. As it has also been well maintained by the members of the community, the bridge has had the desired impact, and more. In fact, the cost-benefit analysis showed that every Philippine peso invested has provided 24 times that amount in impact.
So in this study, we try to make use of a computer model that will actually put a monetary value as to the activity that was carried out. Say, for instance, in a health situation, you would now have better access to medical care, you would have better access to medical institutions, which at best should then make you less sick, face fewer sick days during the year, which would make you more able to support your family and yourself, and hence be more productive.
But in other communities, some projects have not been so well maintained.
Sometimes the local Red Cross chapters have worked very hard and long hours, but their resources end up getting stretched too thinly. This can lead to creating community expectations for support that may not be possible to meet, and difficulties in following up on training.
One of the lessons learned is that for disaster risk reduction projects to be successful, they need to be sustained over time. Prior to getting started on any project, the question needs to be asked, will the community have the resources to keep it going? In the Philippines, disasters present risk of injury. And the Philippines Red Cross and the International Federation have together made significant investments in training people in the community in skills like first aid. Trained volunteers like these on Palawan actually used their skills to rescue people during floods in 2008. Volunteers have also been trained to support evacuations before storms make landfall. And these volunteers have made a difference during recent emergencies, such as Typhoon Fengshen in 2008 and Ketsana in 2009. During disasters, water supplies are often cut off or destroyed. To avoid outbreaks of diseases, access to clean water is essential. Communities continually stressed this when asked about their needs. With that in mind, the Red Cross has worked with communities to pipe fresh water from clean sources to people's homes, like Angelina Juans in Malatgao, Palawan.
Nagkaroon ng sukatae, nagdiarrhea mga bata at dinala naman sa ospital. Tapos yung mga bata payat, tapos manghihina sila.
In many places, sea walls and dikes have been constructed to protect houses and crops near the coastlines. Lives have been saved and livelihoods protected in the face of a changing climate. And communities are involved in planning and construction, like here in Palawan. The study showed that in one particular location, in Surigao del Norte province, a 300-meter seawall would serve its purpose for 20 years, yielding a cost-benefit ratio of nearly 5 Philippine pesos for each 1 peso that has been spent on its construction and maintenance. But, like the Hanging Footbridge and any other project, the involvement of the community and local government in ongoing maintenance is vital. The importance of good relationships with local government was one issue that surfaced often throughout the study.
To have really focused, strengthened work with the government, because we are not a standalone thing. We need support to ensure sustainability of our activities. And if we work with the government, we ensure that we contributed to the framework that the government is having, and then it will be easily adapted in the community. Because at the end of the day, the government is also part of the community that we work with.
The qualitative impact study and cost-benefit analysis confirmed that the basic models for preparedness initiated in 1994 were sound. Indeed, communities have become more resilient and lives have been saved.
Gusto ko talaga kasi makatulong ako talaga sa komunidad.
The study and analysis also listed the lessons learned and gave recommendations on how to scale up disaster risk reduction projects in the future. Red Cross and Red Crescent National Societies have worked in the field of disaster risk reduction for decades, always convinced that many lives can be saved through proper preparation. Today, through reviews like this one, we know it is better and more cost-effective to invest in risk reduction before emergencies, rather than merely in response after a disaster strikes. The Philippines study has provided us with a clear sense of value, while pointing us towards even stronger programs in the future.